Hello, I'm Ann Mills. I'm a first-year student in the Health Education Master's Degree program at Texas A&M University. I came to the program with no previous training as a health education specialist. My undergraduate degree is in the very unrelated field of finance and accounting. I have in the past been trained and certified as an EMT in order to serve in the volunteer ambulance service in the rural community in which I lived. I'm sure you've heard that it's never too late to follow a dream. This is what brought me to health education as a career. I spent 28 years in the chemical industry as a finance analyst. I enjoyed that time and the experiences it afforded me, but at the same time, I wished for a career that would give me the opportunity to provide service to others, to have personal interaction with clients, and that would involve something that I was passionate about. I've always had an interest in healthy living, and I have made the effort to live a healthy and active life, and I want to help others to do the same. I watched the generation before me develop and suffer from chronic diseases. They did not have the benefit of the amount of evidence-based lifestyle information that's available now. There have been tremendous advances in keeping people healthy. I have a passion to share this information with the current and future generations and to counsel clients toward a healthy life so they can get the most enjoyment and fulfillment from their lives. The goal of health education is to promote, maintain, and improve individual and community health. Health is a holistic concept. It can be described as a state of complete physical, mental, and social well-being. Health is a resource for everyday life. It's a way to reach one's goals in life. The focus of health has shifted from infectious disease to chronic disease, or diseases that were in a large part the result of the way people lived. Health education and disease prevention have the greatest potential to reduce morbidity, save lives, and reduce healthcare costs. Healthcare expenditures accounted for 17.9% of gross domestic product in 2010 and is projected to go to 20% by 2020. Primary prevention should be the most important priority of healthcare reform in this country. Although medical treatment is important, primary and secondary preventions are imperative. We are making progress in this 10 plus years into the 21st century, and the health of people in the U.S. is better than any time in the past. We are healthier, live longer, and enjoy lives that are less likely to be marked by injuries, ill health, or premature death. Yet, we can do better. The purpose of health education is to positively influence the health behavior of individuals and communities and the living and working conditions that influence their health. As a health education specialist, I would be committed to creating interventions that can assist people in working towards better health. I'll be able to assess the needs of the priority population, to set goals and objectives, develop an intervention, implement the intervention, and evaluate the results. And additionally, to serve as a health education resources person and to advocate for the development of policies that support the health of individuals, groups, and communities. And I plan to accomplish this following the basic principles of health education specialist: to value life, to strive for goodness and rightness, to do so in an environment of fairness, to be honest, and to respect the individual's freedom to choose their own way. Memberships in professional organizations encourage health educators to get more involved in advocacy for the profession and for health-related issues. They also serve as valuable sources of up-to-date information and enable health educators to share and hear new research findings and to network with fellow professionals. I have a special desire to eliminate health disparities due to lack of access to health care and lack of quality care that can be associated with characteristics such as race, ethnicity, gender, location, and socioeconomic status. Fear, misinformation, and lack of resources contribute to poor health outcomes. We have the opportunity to make a difference in the lives of others. Healthcare is a hot topic, and as the population ages, the role of the health educator specialist will grow. It is my goal as a health educator to work with individuals for behavior modification programs, to develop and support public policy, and influence changes that create healthy environments where people live, work, and play. The future of health education is very positive. Prevention practices can save millions of dollars in healthcare costs. Health educators seek to motivate clients towards balance. Wellness is the integration of the spiritual, intellectual, physical, emotional, and environmental dimensions of health. The optimal state of wellness occurs when people have developed all the dimensions of health and form a whole, healthy person. The future is ours to create. I was struck by a quote from Ashley Montague and choose to adopt it as my health education mantra. The ultimate goal in life is to die young, at as old an age as possible. Thank you.